Well, we're here in Nanyuki now doing the 7th MEEK orthopaedic mission to Kenya. This is the 4th time we've come to Nanyuki. This hospital is moving ahead as far as trauma care and procedures are concerned. We're very happy to see that the hospital is improving its standards enormously, to the point that it's now been given a grant by the Kenyan government to make it a major trauma centre.
We were talking about the problems that there were with trauma patients out here and how trauma patients weren't treated. There were many of them not treated effectively, and then Danny suggested that maybe we could look at bringing out a trauma team to Kenya. At the time I didn't think that would be possible. I didn't know how I would go about it. But through working really closely with Ndanya, I put up a little notice in the theatre coffee room, and I was really surprised because we had lots of interest from nurses, consultants, anaesthetists, and loads of people came to the meeting and said they'd like to come.
Through the interaction with the doctors largely from the south of England, that have been coming in, and other places from England that have been coming in almost 4 years and collaborating with us in the operations that we do. We have also formed partnerships that have enabled us to be able to manage probably higher levels of trauma than we otherwise would in our setting, because we are able still to collaborate and discuss cases and plan.
I think what attracted me to the project really is the opportunity to come and work in a developing health environment, and to bring some help to patients who really, without the right surgery, are going to struggle in terms of their day-to-day activities, and just getting back to normal life and looking after their families.
Okay, so we're on the male surgical ward here with Peter Mafenga, who's 34. He's normally a gardener, and he was going back home to visit his wife. He was a pedestrian on the road, and he's just hit by a car. And he's been assessed on admission. He's just got an isolated fracture of his left lower leg. It's an open fracture of the tibia, which means that the bone is poked through the skin. This isn't treated rapidly, that he gets an infection in the tibia that is there for the rest of his life. So here we are 5 minutes after starting to give Daniel some sedation, Peter some sedation. You can see that he's, despite this severe fracture, he's very comfortable now.
Then you have problems closing. It is a fresh wound, you are only excising the edges.
Actually avoiding a bigger problem with the second procedure.
We like to work with the local Kenyan surgeons and their team, partly to obviously to assist them with their workload, but also hopefully over time to encourage that, bring on their skills as well. There's no doubt they have a lot of skill and a lot of talent here, but there is no doubt problems with funding, problems with equipment, and these are things that we can help with to a certain extent.
Well, a work of art.
He's saying he's very happy about the operation. He appreciates that he's been operated on early. Most patients usually have to wait a long period of time. He appreciates that he can go home early and he can resume his duties as soon as possible.
Yeah, keep it clean.
Yeah.
Really, really clean. Yeah, no flies, no dust.
Yeah.
Is it good? Okay? Looks really good. Yeah. Really, really good.
I was inspired to set up Kenya Orthopaedic Project initially in 2008 when I met a lady from one of our rural communities who'd been crushed by an elephant and had fractures of both her femurs. She was unable to afford surgery for her treatment, and as such she remained disabled for life. Her 2 young children had to go and live with an aunt and were essentially orphaned from then on. The World Health Organization that year named trauma as the leading cause of death and morbidity worldwide, and paradoxically there were very few charities offering trauma care to patients due to the huge expense of trauma operating and the implants needed.
We're hoping that with continued cooperation between Meek and the Nanyuki District Hospital here, we'll continue to help this hospital improve to a standard where it will become the major trauma centre for this part of Kenya.
Right behind me is a new building which will be the first emergency department in this region of Africa. We have a solid concept of emergency medicine in UK and our population depends upon it for their safety. This will be the first department of that kind in this country, and what it means to this population is immense.
A lot of the people who have come into this have really bought into the idea, and I think that colour has nothing to do with it, age has nothing to do with it, speciality has nothing to do with it. I think it is just what people should do. I think it's more than it's something that it should be bigger than this. This is in orthopedics, but I think it should be in every aspect of life, and you have seen that and much more of it. And I'm hoping that this is going to be just the beginning, and that we are going to go much further.